Welcome to the next episode of the Link podcast. Today we have joining us Janelle Dunn from True Health in Central Florida. Very excited to talk to Janelle about her journey from operations all the way to CEO and some of the insights that she has for us today.
Thank you for having me. I appreciate the opportunity.
Thank you. You're our first guest from the East Coast. So, yeah, so we've had some others. I don't know if you've listened to them, but we've had some others. One individual was real focused on the migrant seasonal. He'd actually been a migrant seasonal farm worker. Another one is really involved in homeless sheltering. And so anyway, kind of a mix of individuals, and you have a real interesting background. So as we get started, can you give us a little bit about your background just to kind of kick off the show?
Absolutely. You want my personal background or did you want my professional background?
Well, I'd like to hear your personal background, but we only have, how long do you have? Do you have more than 45 minutes? Are you
I have an hour.
An hour. Okay. Well, I guess you could take it 5 minutes on your personal and 5 on your business.
So just briefly, I'm from New Orleans, Louisiana, born and raised, single parent, family household, but really rooted in education, in that my mother used our family friend's address, and it allowed me to actually get into a great elementary school, which I believe was the foundation for my quest for learning and always being open to learn. And so I met also lifelong friends. My actual best friend and sister is someone who I met in kindergarten. And we're best friends and everything until this day. So we're talking a long time of sisterhood. And so, really just inner city New Orleans. And really had to be independent at a younger age, be latchkey kid, very much so evident of the types of environments we see many of our patients at True Health in today, right? And so, my mom was a smoker, and she was actually diagnosed with, hypertension, and she passed away from a massive heart attack at the age of 47. So that's always been my why as to smoking cessation information, exercising, eating habits, all of those experiences really kind of forged me to want to live differently so I can live longer. And at the time, I was only 21 and my brother was 11.
Wow.
So I became an instant mother.
Huh.
So, those changes in my lifestyle, it could have been a setback, but of course I used everything in me to try to continue to move forward after losing my matriarch, to be able to, be a better parent, a better spouse, to be a resource for my little brother. So that's me personally. Professionally, I have been at True Health for the last 12 years. And I started off as a center manager for one of our offices in Orlando. And honestly, at the time, I really enjoy helping people in a clinic setting, but I yet had not decided what was I really going to do with my experience in education. But ultimately, what I realized was the health center setting was a better option for me, because you keep seeing people over and over, because it's a primary care office versus a hospital where it's, you treat them, but you may or may not see them again. And if you're a back office hospital, you really never have patient contact. Mm-hmm. And so I really felt internally rewarded when I could help a family that may have an autistic child, to be able to get healthcare in a way that it was conducive for her, or, finding solutions to see our inmate patients who may still be in shackles, to still give them dignity in healthcare, to be able to assist patients who may speak a different language, to let them know that I valued their cultural differences and I chose to learn to speak their language, which was Spanish, and try to get them through a demographic intake, as best I could. And all of that was rewarding because when they see you try, they try, and I just really enjoyed that connection. And so I was promoted to director of operations in 2014. And at that level, I was over all of our health centers and a lot of our ancillary departments, such as medical scheduling and medical referrals. And honestly, I still felt the connection to be able to be a better administrative resource for our patients. So I still had the connection, but I was now able to build some resources and supports to help better our internal operations. And so that's kind of what my role was as director. I was over almost every project, including any expansions because my mindset is to always try to figure out the most efficient way to do a job or a task. And then in or around 2015, 2016-ish, I was promoted to chief operations officer. And at that level, it was really more relationship building in our community so I can bring resources into the organization, and really managing at a higher level the operational workflows and bringing in resources and supports and supporting the staff and being that I had already worked and, operated a health center. Now I can actually add value to our newer team members and be a mentor for them. So that was actually super rewarding. And it allowed me a first-hand glance at all of the departments, because in your executive meetings, you're hearing about, all of the opportunities to be better in other departments. In the midst of the pandemic was when we had a changeover in our administration. And the good thing about that was I was already so embedded in our operations. It was ideal for me to be able to come in and take over the role, but transparently, I wasn't quite certain if that was what I wanted to do because there was so much to do to kind of right the ship again. And I wasn't quite sure if that was something that I wanted to do. But my team members and my peers, they were supportive of me actually going for the role. And a lot of our partners wrote letters of support to support my application. And so I thought, well, okay, if external partners see that I'm an asset and I'll be a value add, if my internal executive team feels that way, and a lot of my director teams who I supported felt the need to write a letter for me, well, this might be something that I should really consider. And so I prayed about it, and it was something that I decided to ultimately do because I knew I had already been here for, I think, about 8 years. And so I felt if someone came in from the outside, they may or may not, hold on to our values of the organization and align with our mission. So I felt that it was probably the best thing for me to do. Otherwise, it could be someone else's vision that would not align with the history of the organization. And so I decided to go for it and was appointed the CEO in the midst of the pandemic.
All right. That's really interesting. There are a lot of questions that came out of that in my mind. I don't know. Yeah. We've got a list of questions, and then I have kind of impromptu questions. Can I ask you an impromptu question?
Sure, of course.
So out of curiosity, you said when you were in like grade school, or there was that independence, you had to really step forward and exert yourself. How did you, what made you different than others? Because I see that, some people step up and swing the bat, and some people sit on the bench and say that person needs to swing the bat. And I've always said it's better to strike out swinging than it is to sit on the bench and complain about the person that's striking out swinging. So where was your motivation that really, what was the internal fire that caused you to, step up and swing the bat?
That's a great question. And I often wonder that myself, but I think ultimately where it boils down to is I came from that era where my mom was able to send me to the grocery store and I can go buy cigarettes, right? That was before they changed the law where you had to be 18. And we didn't have a car, we were always on public transportation. And I would tell my mom, I'm like, Mom, if you didn't buy this $4 pack of cigarettes, we could actually save this money every week, and then we can buy a car at the end of the year. Like, I remember telling her what I felt like could be little money savers. And my mom also wasn't really good with her credit management. She would get a credit card, it would go to the max. And, so she was a great mom. It's just, I felt that there were ways that we could probably have a better lifestyle. And I used to always kind of see that at a younger age. And I would always say, like, Mom, you should stop smoking. Like, it was innate. And when I was able to get on my feet, honestly, I did. I went to college. I'm a first generation college student. And she was so proud. And I remember, like, kind of having that we did it moment together, because, she's living vicariously through me as her oldest daughter. And I stayed home through college. And I'm so thankful I did, because I was able to get that last 4 years with her before I moved out to go to Houston, Texas. I moved to Texas because I felt like I needed to learn to be independent. I didn't know how to be independent of my mother. And I believe that my desire to make her proud, my desire to just really be in a better familiar situation. Like, I wanted to be married because my mom was a single parent. Like, everything that I felt like could be different than our situation at home and that I saw my friends have, I was like, I want that for me. I want that for my kids. I want my kids to have the same dad. Like, I just wanted all of the differences that I saw. I wanted that for me as a young kid. I wanted to sit down at the table and be like, pass the peas. And I wanted to have a car. I wanted to have all of that. So I wanted to make sure that if I was an adult, I was able to provide for my family. And that was my internal driver. And so once I was able to provide for myself, I bought my mom a car and I surprised her with it. And I'm like, I brought it down to Texas. From Texas to Louisiana to her. And I surprised her with it by making her come outside. I made her think that my little brother was having a fight. I called the neighbor across the street and was like, call her and tell her Lawrence is having a fight. And so she comes running out, and then there's like this big bow on the car, and it just the look on her face, and she crying. And I'm just like, I did that. Like, I was able to make her so happy. And so I think of that moment about everything that I do in my own life. When I first had my kid, I wanted to make sure I was a proud mom for her. When I decided to go back to college, I was like, oh, I wonder what my mom would feel, because by then she's already deceased. And so I just always want to make my mom proud. That's the first thing I think about when I make a decision. It's something that is my internal motor. And I want to make, now, since I'm a mom of two, I want to make my kids proud. And, the funny thing is when I was awarded the congressional honoree, and being my bio being read into the Library of Congress, my son was like, Mom, you're my hero. Like, that made me ultimately like, this is ultimately why, this is my internal why. And so I just tell my son, I'm like, take the torch and you keep on, carrying it forward. You keep on lighting the fire. And so, that's why. I think that's why. I think it's just that internal desire to always improve.
Cool. That's good.
It's awesome. I love that story.
Thank you.
I feel like we're lucky we're getting through this without crying. I feel that's going to come up sometime during our conversation.
Listen, I definitely get emotional when I speak about my mom, because she was awesome. And then when I show pictures, everybody's like, oh my God, you look like your mom. And I know I do. And I know that her spirit lives in me. And, unfortunately, I just feel like God took her early, because she is up there now protecting me on a different level. And so, for those, but I'm also the advocate. So when I'm dealing with youth, or if I'm dealing with a, struggling adult, I'm telling them, like, I know it can happen for you, because the writing on the wall was not for it to happen for me. So if you apply yourself, and there is hard work and dedication and unrelentless goal setting, You can do it. You can be anything you want. And I tell that to my kids. I tell it to my 6-year-old. I have a 6-year-old and a 20-year-old. Same
You,
day. But I just tell them all, like, you can do whatever you put your mind to, and never let anyone change your mind.
yeah, good. I think that's really true. Yeah. So out of curiosity, how many languages do you speak?
So really, I speak English and a little bit of Spanish, a little bit, not enough anymore, because when I moved from our Lake Underhill office, a lot of my Spanish skills left because I wasn't using it as often in the administrative roles. But I do love the Hispanic culture. We have a lot of Haitian Creole, so I try to learn French because I'm from New Orleans, so there's a little bit of French background in there. And so, but in the case where I cannot speak the language, of course, I'll use our translation assistance. But
Okay,
native, I'm an English speaker.
good.
Yeah, great. One of the questions I had, Janelle, when you were talking about your background and your rise up through the True Health, was you really made a switch when you became COO, it sounds like, and your focus became very community and bringing in partners and resources. How did that come about? Was that something that you came up with yourself? Was that part of the strategic plan, a directive of the CEO? How did that come about?
It's organic for me. I'm a relationship builder. And so um, I looked at my role as the ability to connect with the community, to your point. So, for example, if the health administrator from the health department was having a bring your loved one to a doctor day, and they would call, if we were out of town, if we were at wherever, and she's like, hey, can I get your podiatrist to come over and actually be a part of our event? I would contact our provider and, arrange for the provider to go over and support the event. Those little bit of relationship building and being, a reliable resource for our partners allowed organic relationships to foster, where if I saw them at community events, we're talking, I make certain that I'm checking in with them and supporting their events. They come over, they support our events. And so it really wasn't an exact directive, but I feel like that's something that should continue on. And I think that it doesn't matter what level you're on. I believe that if you're a, frontline employee as a patient service representative, you come into contact with vendors and you come into contact with the local businesses when you're frequenting them, especially if there's restaurants around. I think everyone should be advocating on behalf of the services that the health center provides. And it doesn't require a directive. I think that that should be something, if it can help someone, you're just sharing information. And yeah, it is a big shift from being the doer to being the overseer, kind of like the checker of the work that's being done. But I've always been a leader that didn't tell my team something that never would step in to help. I believe in leadership like this and not vertical. So I think that has always helped me to get buy-in from my team. I think they know they can, rely on me. Is it more work for me? It is. And I know that that school of thought is sometimes frowned upon by leaders. They want to just give the work. My school of thought is I can do it, but I can also support them with doing it. So if they have a question about, past experiences, they don't have to reinvent the wheel. They can actually come to me and I'm a resource for them. And I'm the same way when I'm mentoring someone. So I have mentors outside of the organization that may be other female leaders up and coming in their careers. And if I'm recommending, like, one of my mentees, I said, I think you should go back and get your accounting degree and, maybe get a certificate or something, because I think that that will help you be more confident and grow. And not only did I just tell her and gave her the idea, but I also sent her some schools and some colleges that may be able to assist her with that. So that's my leadership style. It works for me because then I feel like I've given the person all the resources to be successful, and they can also kind of build upon that and decide to do whichever approach they want that they feel is best for their situation. Um, and so that's the way I lead. I think and even as in the CEO, I do the same thing. If I am connecting with an audience, I give my personal cell phone number out. I don't mind getting calls. I don't run from work at all. And I feel like people can connect with me and they can relate to me because I feel like I know that I know that I care, but I do think that it comes across that I really care and that I'm empathetic to what their situations are. And so I think that that's kind of been a nice little mesh between COO and CEO roles.
So out of curiosity, you have a lot of community connections, a lot of relationships. How have those strengthened and possibly even improved your kind of stability and success as an organization?
Absolutely. I can share with you specific examples because I believe in those. I specifically want to give you an example instead of speaking generally. During the pandemic, obviously, information was changing by the minute, by the day, by the second.
Yeah.
We, at an early phase, decided that even though the vast amount of physicians were not going to test anyone who was under 18, the youth, they also decided early on that they weren't going to test anyone who did not have symptoms. This was very early on. We always decided that we would, as an organization, we would still test anyone who needed a test. And the reason why we decided to do that was because we knew young people had to go home and they might go around a grandparent and they could possibly infect them. So we already became the FQHC in the Central Florida area that had the highest test numbers here in the Orlando, Sanford area. We were the highest health center that was testing. And then there was the opportunity for us to partner with the health department and the Office of Emergency Management to do an infusion center once there was the opportunity to have the infusion, the COVID infusions. And so because we were a partner of choice for testing, because we were out doing testing in hotspots, and because there was all the relationship building that had occurred, they came to us first to the table to say, what do you think about putting an infusion center together so that we can be able to assist our uninsured and our underinsured and our senior population with access to the life-saving therapy, but then also keep them out the hospital. And so initially it was something so new, right? No one had done it. There was no roadmap to really rely on from the other health centers. And so, we worked with the health department, Office of Emergency Management, and we were able to get the resources in so that we could launch the first and only infusion center operated by an FQHC in the area. So our uninsured, our seniors had zero cost out of pocket for that life-saving treatment. And the hospitals enjoyed being able to, really partner with us to know that our services and our partnership allowed for their hospital beds to stay available for those who really would have been ill. So we had a lot of people who were able to recover at home. We were a trusted partner. We were able to provide a valuable service to people who would have normally paid upwards of $600 at zero cost. So I feel like that was a great win. And I think that was because of the partnerships and the relationships that we had built.
Now, you have a fairly significant fundraising process, don't you?
We do. That lovely shirt that you're wearing from our 5K last year.
So as you look at the fundraising program you have, how has the community involvement affected that, or has it?
So we have grown our fundraising efforts. So initially it used to be like a ball, like a gala, and it was not something that the organization felt was indicative of healthcare for us. So we decided in 2020 to transition in 2021 to having the 5K. I think it was 2022 was when we actually started. We did the planning a year ahead. And we had our first 5K. It was in downtown Sanford on the Riverwalk. It was so beautiful. But then the following year, we couldn't use that route because there was construction because of the water from Hurricane Ian. And so we had to pivot to partnering with the airport. And that has just been such a beautiful relationship. They already do an air show in like October, but they were very open, and we felt like it would be very ideal to bring more awareness to our airport. And it's probably about 4 or 5 miles up the road from our main office in Sanford, so it's super close. It's embedded within the community, and the leadership over there has been so welcoming to the ideas that we bring to the table. And this year it's just really grown that last year was our first year trialing an annual sponsorship packet where sponsors can partner either for specific events or for an annual sponsorship where they're kind of branded throughout every event that we do. And we found success in that because now we're not asking people for every little event. Do you want to support the community day? Do you want to support the 5K? Do you want to support this? They can choose and have the full year or the a la carte event options. And that has been well received from our partners because they can budget better for that. They can contact me and say, you know what, I want to do the annual, but this year I only have 10,000 in this budget, 5,000 in the next, but I still want to be that platinum sponsor. And I'm like, absolutely, we will bill you however you want. But now they know that I don't got to go back to them, for a grand opening event, for the staff meeting, or for a provider meeting. They are already built into that. And they have FaceTime, and they have recognition, and they have a lot more that we can offer to them because of the annual.
Yeah, good.
It's been great. It's been really great.
Out of curiosity, over the years, as I've worked in community health centers, it's an area of fundraising, and is an area I frequently see community health centers not engaging in. So they don't really capitalize on what they're bringing to the community, and they're not beating the drum so the community knows what they're doing. So if you know this, if you don't, that's fine. But out of curiosity, do you have a sense of what percentage of your budget is fundraising from maybe 6 or 5 years ago to now? And is that material?
So it is, and let me tell you why. Very material, because when we were doing the gala, we would spend so much money out on the hotel, the food and beverage, the entertainment. We probably, if we had a profit, it would probably around 65 to 70,000, but then all of that really went to the event. So we really didn't have a surplus, a large surplus, maybe 10,000-ish. But our main sponsor is Advent Health, which is our local hospital. They have been such a reliable partner for True Health and our patients. We also service hospital ER diversion, so as most health centers. And so they are so vested. They are our annual diamond sponsor. And because of their sponsorship, like the event this year has already earned over $200,000 for our
Wow.
efforts.
Great.
Right? And it doesn't take much to do a 5K in the sense of, yeah, you got your shirt, you have your medal, right? But we have the space, the route at the airport is in kind. So we don't really pay like a event fee for that. And so it's really been strategically, it's been a much better margin so that we can actually put a lot more of that margin back into seeing our patients.
Yeah.
So if I had to put a number on it, I would say maybe last year we probably averaged around maybe like 134,000. And this year we're on track to probably be around that same amount when you take out the, because we do have a fee for the race coordinator. So, when you take that out, we still have I feel like it's still better than not having a fundraiser at all.
Oh, yeah.
Oh, yeah.
Yeah. I think there's a value too in that your name gets out there. And the more people know who you are, the stronger you are.
Absolutely. And then with the kids run, people are always looking for something fun to do with their children. And so being that the kids race is free and they get the same medal, it's super cute. My daughter has ran it's like a 1 mile dash. And even though she was 5 last year, she really enjoyed it. And she thought it was such the it was a personal reward for her too, to be able to earn her medal when she crossed the finish line. So she enjoyed that.
Yeah, you could do a quarter for a quarter, where they run a quarter mile, and you have little cans along the way, and they put quarters in them,
Oh,
and you get the quarter.
I like that.
I heard yesterday on another conversation that they, in the Spokane area, some nonprofit gets like $14,000 over a 2-week period for the money that people put in around Christmas time.
Oh, wow.
So you could do it. Yeah, there you go. I'll expect a quarter for a quarter. Next year, too, you're making so much, I'll expect a shirt with maybe a collar on it. Go ahead.
Oh,
I'm
man.
asking all the
Oh, I was
questions.
just going to say that your point too about the gala not really feeling like it was in alignment totally with what you're focusing on with your mission. And just this whole health piece is amazing. And just like you said about your daughter doing that run so young and just getting into it, that's really exciting. I love to hear
Absolutely.
that.
Absolutely.
So back a little bit, before you started working at True Health, you came into True Health as a site manager or kind of director of sites or something.
No, I came in as a center manager, so I just had the oversight of the physical location in one of our locations in Orlando.
Okay. What was your background? What brought you to that role? Did you have
So
experience in clinic management and site management?
I had management experience, but my background actually was finance and banking. And
Oh,
but I had been a manager in that space. At the time, the location had significant personnel and staffing issues. And so from what I understand, the office was in need of a strong leader to kind of get it back on track. And so when I first arrived, yeah, there definitely was some personnel issues. It was a lot of turnover when I first got there because there were people who definitely did not live the mission. Unfortunately, horror stories like taking money from the patients, things like that.
oh.
And so I got rid of that. Those issues I had to eradicate very early on and then rebuild the team. And honestly, at one point my location was collecting the most. I had the lowest debt. All of my reporting was done on time. And I believe that, that was probably a catalyst to me being the director, because it was, well, if you could do it on this level, you may be able to do it where it's all of our locations and they can kind of run similarly. If there was a new manager, they would send them over to me to provide training and things like that. If there was a new director of operations, they came and trained with me. So, I just really felt that the management style of it, my management style, and then the management need was a nice marriage. And I was introduced to True Health because when I decided to go back and get my master's degree from the University of Central Florida, I knew if I wanted to take healthcare seriously, because I was getting it in Master's of Health Administration, I felt I needed to work in healthcare. And so I volunteered my time at our Orange County Medical Clinic. And I literally worked for free, but I went in like it was a job every day without fail, made relationships, fostered conversation with the leaders. And I even interviewed the health administrator. And I asked her, how did you get to where you are? And mind you, I already have a kid. Like I'm an adult. I'm in my 30s. But I wanted to know, how did she get to her position? And I wrote notes, and she said, well, I hope to see you around. And I'm like, well, it's actually my last day. And she was like, what? And I'm like, yeah, it'll be my last day. I finished all the work early and this and that. And so she was like, oh, okay. And I said, unless you want to keep me on. And so she brought me in as a student intern. So I was actually now getting a little stipend to work at one of the health centers. And that health center happened to be True Health at the time. And
Huh.
so I started working for the county as a student intern first. And that's how I got introduced to the organization. And one of the employees at the center, they said, you should apply for the manager job. I think you'll be good at it. And I'm like, oh, well, I was going to school at night. And I'm like, I don't know if I don't even know if I have the capacity. But then I thought about if you want to be taken seriously, you need to go ahead and get your foot in the door. This is your foot in the door. And so once I started at True Health, I never left.
Cool.
Oh, that's great.
Yeah. So, and in 10 words or less, what is leadership? That's been a big theme in the conversation up to this point. And I think, I think again, it's one of those skills that a lot of people don't really understand. They talk about leadership, but they don't know what leadership is. So in 10 words or less, you tell us for the world, what is leadership?
Leadership is being humble enough to know that your team comes first and that your ability to provide the resource is what matters the most to them. Team first, and then you support them with resources to do the job.
Good. Well, that was over 10 words, but
Sorry. I tried to summarize it with
that was really that was really a good definition. I think that's excellent because I think that is exactly true. Humility and skill set, bringing the skill set to the table and filling in the gaps, helping people. As a CFO, with a lot of years in community health centers, I oftentimes would see things as I came in kind of as a consultant that needed to get done. And either people didn't get them or they weren't doing them. And so it's like, well, this needs to get done. I'm going to do it.
Right.
And it's like, that may seem a little presumptuous as a consultant, but it was like, it needs to get done. Somebody's got to do it. So I'm just doing it. And it was oftentimes really appreciated. So I think that's kind of in line with what you're saying.
Absolutely. I don't know any other way. And I know that a lot of people have their own definition, but that definitely is mine. It's the way I lead every day.
Good. No wonder you're successful.
Thank you.
Let's see. So I'm just actually looking at the list of questions, which we haven't really looked at too much here.
We have a great conversation, though.
Yes, absolutely. One of the things that we were wondering about is you had mentioned your master's degree in health administration, and I know you have some other certifications, especially as we have people who will be listening that are wanting to move into that CEO role. Do you feel that those have been particularly helpful to you as far as the actual knowledge gained, or do you feel like it's just more of the process going through that?
My philosophy on education is that it teaches you a certain way to think. I think it was definitely beneficial to take the health administration approach versus going and get my master's in business administration, because the business administration would have been a generalization of how to do or how to execute business initiatives. But the health administration, I learned a lot about epidemiology. I learned a lot about all of the medical terminologies and things like that, that kind of allowed me to focus in on what I wanted to do in healthcare. And my certification with the Medical Group Management Association allows me to network with other peers in the industry so that I can learn operational excellence practices, financial practices, things like that. And it really isn't in my personal opinion, it really isn't something that is negotiable. I think iron sharpens iron, and I think that in order to be better or to be the best, you need to surround yourself with likewise. And so if there is something that another team member is doing better than me, I want to, that's my best friend now. I want to be a sponge off of what they're doing in order to improve and bring what's applicable back to my organization. And so I think that if it's not a medical group management association, it needs to be an organization that would allow you to really kind of always stay sharpened and being able to bring back valuable resources to your team.
Good.
Great.
So what advice would you have for a CEO or somebody who's stepping into the CEO role?
Don't have assumptions. I say always be flexible. Your day will never be what you thought it was going to be. If you want to be successful, because it has to be some fluidness with your scheduling and with your expectations, because especially someone like me, like I am laser focused. When I have a task, when I have a goal, I'm laser focused. And a typical leader, that's what you want. You want them to be laser focused, but then you also have to have someone who's compassionate, to be able to listen to the team and understand that, for me, synergy is a high priority on my executive team. I love synergy because we can get more done when we, can agree to disagree, but still get the job done. But I believe that, when you're laser focused and you don't have that ability to listen to the team, you lose sight of what the value is that they're trying to tell you about your goal, because y'all goals should be aligned in some way. And so I just really feel like empathy and listening and all of these things that are almost kind of cliche with leadership, but I do think they're important. And so I even have to tell myself that, I started my day thinking it was going to be A, B, and C, but there was such a curveball that came in that A is no longer the priority. Now C has become the priority, and now I have to retool and refocus. And again, I think I mentioned, I don't ask my team to do something that I'm not willing to do. And so there's never a time when someone can even say to themselves or to anyone else, well, she's asking me to work on the weekend and go to this event and she doesn't even go. Like, I will go to events on the weekend. I will give my phone number out. I will inconvenience myself for the greater good. And so therefore I lead by example. And I think that's important.
So it's not a 40-hour work week.
Not at all. Not at all. There's no such thing as a 40-hour work week for a CEO like myself. My husband will tell you, he's always kind of like, you need to go to sleep. But that's the time when my brain is actually able to think and process and kind of solve problems. I'm also a runner, which is another reason why I was a proponent of the 5K. And so on the weekends, I run about 14 miles and I feel really good. And I feel like I can process information, solve my problems, and, personal or work, but it's definitely my little reward for being a mom and a professional and things like that. That's my little me time.
Oh, good. Good.
Great. One of the things that you've talked about is that background that you had in finance and business before getting into healthcare. And definitely from working with you, Janelle, I can see that. And I've always been impressed with your financial acumen. And even when Joel asked you some questions about your finances, like boom, you knew right off the bat. How do you feel that affects your approach as a CEO, where you have that real balance of that business knowledge as well as the compassion and that real feel for the patients?
It allows me to make better decisions. It allows me to use our financial resources better. It allows me to, like right now, and I know you probably have other health centers that CLC supports, and I'm sure that there are some financial issues right now. The Medicaid unwinding has been huge for health centers. We've seen a drastic decrease in the number of patients assigned to us from the medical plans. And, that has kind of debilitated a little bit some organizations where they've had to close services. We're not immune to that. But, we had tried, I got with my team and we developed a plan where it's not about only expense reduction, but revenue generation streams that maybe we hadn't had before. Looking at everything again with a clearer solution to how can we bring in more money? What can we do with the scheduling? What could we do just not to just do a reduction in force, but to also save money with our expenses? And so that has proved to be instrumental for the organization to try to get this curve around us. It's very, in my opinion, it's a great asset to have when we're doing grant writing. and when we're trying to solicit funds from other organizations, because it allows me to, really kind of understand what my CFO is recommending, when she's saying double dipping, little things like that, that you have to always be aware of with grants. That's an easy concept for me to understand because of my fiscal background. But most importantly, I think that's also the biggest part about banking and finance was the relationships. And we'll go back to that. In order to make someone feel comfortable giving you their money, you need to make a relationship with them. In order for them to trust that I am telling them that a loan or a line of credit, or don't do this type, do this, those financial recommendations, that's an intimate conversation. And so you have to build that rapport. I've gone to funerals, I've gone to weddings, I've gone to parties, I've gone to, whatever event that the client has invited me to, because they built a relationship. They only wanted me on their account. And that transcends into healthcare and being able to be a trusted resource and being at the table when leaders are having discussions during a pandemic. They want True Health at the table as the FQHC. And when I'm at the table, I'm not quiet. I am trying to actively add value to those conversations. What's my lens on this? How can True Health be an asset? How can we support the initiative that the greater good is having? And so I believe that all of those resources and, experiences that I had in banking definitely transcends over in multiple ways, and not just fiscal, but also in the relationship building.
So you sound like you're an extrovert, not an introvert.
I'm absolutely an introvert. It sounds crazy, but I am I can stay at home and just be with my little, family and be fine. When I have to, go to an event, I'm like, oh my God, I have to, kind of get into a different mindset, but I think that's important. Like, I think you have to have those different hats to be successful, because if my introvertedness took over and excelled, I wouldn't meet new people. I wouldn't be able to relate to Karen. And I've never really met Karen, but I feel like I know her, and, that's a testament to both of our personality styles. And, I just think that leadership requires you to be able to wear that introverted and extroverted hat. But my genuine, and I've taken a test, Joel. I've taken a test. I'm introverted.
Okay, I was getting ready to send you the Myers-Briggs, Janelle, because I don't believe you.
I know. I swear I do. And I was like, and when you read the summary, it was like, oh yeah, that's her. But I mean, you do what you have to do. And honestly, the 51,000 patients that we serve, they depend on me to do exactly what I do. And I don't take my job lightly. I take it with utmost responsibility. I try to make certain that, the first thing I did when I became the CEO is I implemented an ethic hotline. I wanted to make sure that employees across the organization, regardless of their department, that they knew that they had an outlet to report anything that was unethical. And if it's human resources or risk, or if it's a financial unethic, that goes straight to our attorney. So, I believe in transparency. I lead that way. If I'm telling someone something, I don't want them to feel like there's a hidden agenda. What you see is what you get out of me. And I believe that also kind of fosters trust. So that's really, in a nutshell, like, in my opinion, why I feel that you kind of have to have a little bit of both. And I think that as a leader, you have to just really be flexible.
Yeah. Good. Well, I want to respect your time. We want to respect your time. We're getting short.
Okay.
I listened to, you were on, it sounds like TV not long ago. I had a video. Karen passed over.
Oh, it was 94.5 radio, maybe.
Yeah. And you said that it's all about the patients. And I just wanted to comment and say my background's in the CFO, and it isn't about the patients. It's about the bottom line.
I understand.
Oh, good. Thank you. That's that. You keep an open mind. I appreciate that.
I understand.
The only last thing I have is what parting comments would you have for any listeners? Anything specific or enlightening?
Yeah, I think ultimately, I would like to just kind of give a shout out to the organization and staff at CLC. I will tell you that, True Health has used CLC since or around 2015, 2016 timeframe when we were doing our service area competition grant. Historically, the organization also used CLC for the Medicare cost reporting. And I remember when I was appointed the CEO and my CFO at the time retired, CLC was the first organization that I thought about when I needed a CFO, fractional CFO replacement. And I had a frank conversation with Karen and her team about the mishaps with one of the previous people who was no longer with the organization, but they pivoted quickly and always have. And I don't hesitate. I've had health center CEOs ask me, who do we use? I'm like, we use CLC. I don't hesitate to recommend the organization because we as leaders know that you can't always get it right. We know that no organization or partnership or friendship is perfect. But when you're listening, which Karen does a great job at, when you're listening and when you can pivot to the need of your end user, for whoever that is, your patient, your bottom line, whatever, right? When you can pivot, that says a lot about the culture of the organization. And so we have a new statement of work coming out now where our new CFO is, wanting to really, continue a relationship with one of your team members named Terry for support with the audit. And that's a testament to the leadership of CLC.
Well, thank you.
For us, that has allowed us during a time of need where I didn't want to bring in anybody. I wanted to make sure I had the right fit on my executive team. It allowed me that opportunity. And so CLC has been a great partner for True Health. Thank you for the platform and the ability to speak to you firsthand about my experiences. It allowed me to, really share some insight that I have. And, Joel, it was my first time meeting you, but I hope it wouldn't be my last. You made me smile.
All right.
I appreciate your support.
Yeah, I was thinking we need
an amazing partner.
We need to come down there and run in that 5K.
We'll have to do that.
Yes. You're going to love the weather. It was so beautiful last year. It was like 60, 70 degrees that morning. It was beautiful on the runway. When the sun came up, it was like a movie. An Allegiant airplane was going through the sky. It was just gorgeous. You definitely need to come down.
All right.
We'll have to do that.
Yeah.
Great. Well, thanks so much, Janelle. This has been a great conversation. Love to hear your insights, and thanks so much for taking your time.
Yeah, it's been a lot of fun. Really, I've really enjoyed this. Thank you for taking time. I wish
the best one on the East Coast, right?
That's right.
Yep.
You are the star. All right. Thanks so much.